Hello, my name is Irene Frias, and this is my presentation, The Legacy of Discrimination, Unraveling the Health Impacts of Historical Redlining in Chicago's Black Communities. Why I chose this topic. Chicago segregation has been present all my life. I wanted to explore how current-day segregation was initiated. The literature review examined redlining and health outcomes in Chicago, reviewing research on the historical impact redlining had on access to healthcare within Chicago. The study illuminates historical injustices and addresses the urgent need for investment in health-centered initiatives in Chicago, marginalized communities. This review will note a conglomeration of health disparities in Chicago and the correlation to historical redlining. This presentation will focus on a smaller number of the health outcomes I reviewed. So how is redlining defined? Redlining is a discriminatory and racially motivated approach to housing and loan practices. The term redlining was coined by community groups in the 1960s. Redlining was most prevalent in the 1930s, and it was defined as redlining was referred to the red lines that lenders and insurance providers drew around areas they would not service. So why Chicago? Chicago is one of the most populous cities in the US, while being one of the most segregated. In 1940, Black residents comprised 8% of the Chicago's population, while 95% of Black residents were living in redlined areas. So a bit about the housing authorities. First, the Homeowners Loan Corporation, who was intended to reduce the high rates of foreclosures following the Great Depression. The HOC was established under the Homeowners Loan Corporation Act in 1933 by the Roosevelt administration. The Federal Housing Authority. Under the National Housing Act of 1934, FHA was founded to promote homeownership, provide mortgage insurance to lenders, and encourage housing affordability. Now, the Chicago Housing Authority. The CHA is a municipal corporation that oversees public housing within the city of Chicago. It was founded in 1930 to oversee this. So, a bit on how they impacted Chicago. When the HLC was near the completion of its lending practices, it graded maps of over 200 cities. These maps were intended to allow HLC to manage its portfolio according to the ratings of the areas they categorized. These ratings range from best to hazardous, or A to D. The rating of each area was heavily influenced by race and immigration status, with HLC's description of ratings being heavily discriminatory of Black residents, placing a significant value on race for its area's rating. Despite efforts to confine maps to a limited number of government housing authorities, the HOC shared 3 to 4 copies with the FHA. These copies provided further block level information for FHA maps. At the initiation of FHA, staff concluded that no loan would be economically sound if the area could be or is populated by Black residents, noting that racial tensions would lower property values. But this contradicted the saving and loan industry, who, while agreeing with FHA, just adjusted their loan terms accordingly to this. Furthermore, the FHA advocated for racial covenants to prevent the infiltration of inharmonious racial groups. The FHA favored new construction in suburban areas rather than urban areas, with old housing stock or Black residents living there. And of the 374 FHA guaranteed mortgages in Chicago and nearby suburbs, only 3 of them were in the inner city that was heavily redlined. So more on to the CHA and how the CHA supported segregation by using public housing to isolate, segregate, and confine Black communities. The public housing heavily impacted segregation within Chicago, as nearly all of their residents were Black. The CHA was aware at the time that the placement of their housing would cement current segregation in Chicago. So are here are the maps of the FHA. So this map is the FHA as redrawn by the Chicago Housing Authority. The following other maps of the FHA were destroyed following a lawsuit, and The map next to it is an HLC map, with green being A, best, and red being D for hazardous. So this is a current day demographic of Chicago's race. So with blue dots being Black residents and white and yellow dots white residents, we can note that Black communities live predominantly on the west and south side, whilst white communities live predominantly in the north side of Chicago and nearby suburbs. So, what are the current economic disparities? While 74% of neighborhoods across the United States labeled hazardous during redlining are low to moderate income areas today, and more on Chicago, from 2010 to 2016, the mean household income across Black neighborhoods in Chicago was $47,000, while it was 173% higher in non-Black areas. So I'll be touching on the air pollution more on. So fine particle pollution, PM 2.5, is linked to low birth rate and shorter pregnancy. This contributes to acute and chronic diseases, including respiratory and cardiovascular conditions. Furthermore, areas previously labeled D or C are exposed to statistically significantly higher concentrations of fine particle pollution than those labeled A or B, with the area of the highest concentration of PM 2.5 in Chicago study being populated mainly by Black residents. This will be more on infant mortality and the rates. So the picture depicts infant health with predominantly the west and the south side being on the top tercile, meaning that they face the most. So the preterm birth rate in predominantly Black communities is 58% more than white ones. Despite programs to provide assistance, there is an inequality in healthcare more than this, as the Black infant mortality rates are 3 times higher than white infants, with health for infants problems heavily concentrated in the west and the south side. Infant health and infant mortality severely impact communities' overall well-being and mental health. And life expectancy. This picture depicts the life expectancies with darker blue, meaning longer life, and lighter tealish, shorter lifespan. The life expectancy gap between Black Chicagoans and white Chicagoans is 9.1 years, with Black residents' life expectancies at 71.5 years, and that's with white residents at 80 years. The disparity between black and white men is even higher, with 10.5 years. Even then, COVID-19 had a dire effect on life expectancy for Black communities, especially elders who face more biological weathering allostatic load, which in other words mean Black bodies face so much weathering that they can be biologically 15 years older than their actual age. COVID-19 then lowered the life expectancy of Black communities by 2.5 years. This is compared to the lowering of white communities by 0.8 years. This is a difference of 108%. So health outcomes. These are only a few of the significant health disparities that face Black communities in Chicago, with more on lead poisoning, gun violence, and its community effects like over-policing, and more COVID-19 transmission and impact. Incredibly prevalent amongst Black communities are these issues, and are most notably in the West and the South Side. So, conclusion. What changes need to be made? Policymakers must be invested in aiding and diminishing racial health disparities in Chicago today. Addressing these health outcomes in future policies will help Black communities prosper. There should be efforts to work with community members to understand where they need support as a neighborhood. Moreover, education on the racial disparities within health outcomes throughout Chicago is vital in establishing community initiatives to work towards aiding these disparities. Thank you. This is everything for my presentation. Thank you for listening.